Howdy! Welcome back to Healthcare Ain't Easy, presented by Chris Matthew. By now, I'm hoping you know I'm Chris Matthew. Happy 2024. We get to do big things together this year. We're here with a special New Year episode where we're going to look back at our journey so far. Our guests from the first 10 episodes shared their expertise and experiences and insights in a variety of areas, from hospitals and clinics to FQHCs, from patient care to administration to health insurance. And based on what I've learned from speaking to all of these wonderful people and many more throughout my career in our industry, I have something I would like to ask of everyone here in healthcare as we go into this new year. So stay with me for just a quick bit as I do a recap of our episodes so far to catch those up who may be new to our podcast. You may even discover an episode that you haven't listened to yet. Give it a tune. Okay, let's dive into a quick recap. In our first episode, I set the stage for the journey together, where we're going to highlight the significant role of AI and technology here in healthcare. Even though healthcare ain't easy, there is still progress being made. Remember, it all starts with why. You've heard me say this before, but I'll share my why once more. It's to connect with people so that we can boldly contribute to an improved world. Have you identified your why? If you have, will you share it with me? We learned about the art and science of attracting and retaining employees with the right benefits with insights from Carter Wines. A key takeaway is partnering effectively with your benefit broker can make a big impact for your business and your employees. Episode 3 was with Dr. Jeff Kerr. We walked through his journey from a community health center to chief medical officer of a major hospital here in DFW, emphasizing the impact of virtual care on healthcare and how they navigated the pandemic and how he navigated as a physician leader. After Jeff, I was really excited to have Rich Blanton, CEO of Sniffle. Rich is my business partner, and he shared his vision for transforming the healthcare industry, bringing unique insights from his successful startup experiences into the conversation. Remember, in that episode, we talked about how Rich is batting 1,000 when it comes to startups. What we're doing at Sniffle is big. We welcome you to join us on our mission to provide better care in a bigger picture, better care for physicians and clinicians and patients. And the bigger picture is to help reinforce the relationship between providers and their patients and encourage the importance of continuity of care and increase health equity for people across the nation. At the Athena Health Thrive Summit in Austin, Texas, we met Katila Farley. It was delightful to make her acquaintance and discuss the potential of AI in primary care, reminding us of the importance of a robust primary care workforce. We fully agree with her and the folks at the Business of Primary Care podcast that we all benefit from a strong primary care workforce. Episode 6, we navigated the past, the present, and the future of healthcare and FQHCs, federally qualified health centers, with Andy Berman. Andy offered invaluable insights from his extensive career supporting FQHCs for over 30 years. FQHCs serve an incredibly important role in supporting healthcare for millions across our country. Episode 7, we had Amanda Brummett join us, and she gave us a glimpse into the future of tech and healthcare coming together, exploring how AI and advanced tech could help private practices do more with less. She and her team at the Brummett Group are doing for practices incredible things, helping physicians across the nation succeed and win. Episode 8, engaging in a thought-provoking discussion with Dr. Harvey Castro, we examined the potential and challenge of AI in healthcare, even discussing its potential to bring joy back to practicing medicine. It's such a treat to talk to a successful physician entrepreneur and technologist all in one person. Episode 9, we learned about Steep Healthcare with Dr. David Ballard, delivering the transformative work he has been doing throughout his rich career in medicine Dr. Ballard is determined in continuing to contribute to healthcare, and that in itself is awe-inspiring to me. Episode 10, we had Chris Hamilton. He helped us understand how to take control of rising healthcare costs, discussing the challenges and potential solutions in health insurance. His perspective and approach to driving results with the disruptive playbook is something I applaud. Those were our first 10 episodes, and it was a lot of fun sharing time with each of these individuals. We may be looking back, but it's all with an eye towards the future. Healthcare ain't easy, but it's our collective responsibility to stay focused on finding answers to the problems we're facing. Being brave enough to acknowledge these problems, explore solutions, and then bold enough to implement those solutions. As we step into this new year of 2024, let's remember that every one of us can be a leader of change in our own unique way. Consider joining me in my New Year's resolution. Let's give a fresh look to old problems and being open to solutions, both big and small. This is a commitment I'm making to myself and that I make to all of you. We can do big things together. Here's to a year filled with progress and positive transformations. I'm grateful for all of you that share your time with me and our guest. Thank you for your comments and the positive feedback we've received from so many of you. It fuels us to bring you more. Stay tuned for more episodes of Healthcare Ain't Easy.